Okay, so this is an initiative of the European Academy of Optometry and Optics. And to start with, we will have a small address from our president, Liliana Stankova. And after that, we will start with discussing some aspects related with the dissemination of visual health opportunities, to understand better what we are doing at our regional level and what we can do even more, or we can do better or differently, sharing the experiences from other people. So with me is also Daniela Oehring that will co-host the session with me and will assist me particularly in the last part of the session with the moderation of this event as well. So thank you, Daniela, on your role of member of the Board of Trustees, which is a great responsibility we have to hold and steer up the activities of the Academy. She's also helping me with the technical duties, admitting people and keeping everything on track. So without any further delay, and because we have 1 hour of time, we want to take advantage of that as much as possible. And I will start sharing with you the address of our president, Liliana Stankova, that would like to share with you some words before we start. So I hope you will receive her sound through my computer.
We can't hear it, José.
No?
We still can't hear it.
Okay, okay.
Oh, she's here, so maybe she can address it by herself.
22.
So you cannot hear, right?
We couldn't, no.
You could not hear the voice of Liliana. Let me start again, interrupt the sharing, and let me share again. Okay, Liliana is with us, but if we can hear her video, I think she will prefer it. So let me see if you can hear now.
Dear colleagues and friends, to mark World Sight Day, we from the European Academy of Optometry and Optics decided to hold an open discussion session on the promotion of visual health across Europe. This is also the kick-off for the Academy Hour sessions to discuss around relevant topics for the European optometry and optics community over the next months. Eye health impacts education, employment, quality of life, poverty, and many other sustainable development goals. Prevention is key to reducing the burden of vision loss, and it's emphasized by this year's theme, Love Your Eyes of World Sight Day 2022, promoted by the International Agency for the Prevention of Blindness. The European Academy provides much needed voice to help advance optometry and optics, develop scientific knowledge-based support, and promote lifelong learning for optometrists, opticians, and vision scientists. Our vision is to be the leading European eye care professional networking organization that harmonize and raise standards in education and praxis in optometry and optics for the benefit of public eye health. I welcome you to this session to discuss how our professions can contribute even further to promote the visual health of the population and help everyone to love our eyes.
Thank you, Liliana. We know you are here connected. Hopefully you made it, but probably your connection, we were in doubt that the connection could be not such a strong, but well, your message has passed through. Welcome.
Yes, thank you. Thank you, José. I'm happy that I succeeded. It's a bit noisy here. I apologize for it, but Napoli is Napoli.
No problem. We can hear you well. Okay.
Thank you.
So, thank you. Well, here we are. So we are here some educators, clinicians, and other people will join, I believe, over the next few minutes. So this is expected to be an interactive session. And I would like to start sharing with you one survey we would like to well, fill here and capture your sensitivity and what you are doing in your regional level. But probably before doing that and waiting for some more people to join us to make that contribution a little bit more meaningful, I will start saying some words. So along the year, and more often, we have several days, weeks, or periods of the year dedicated to some relevant aspects related to vision health. For example, tomorrow we will have the World Sight Day. So this is one of the reasons we are here, as Liliana said. So starting a period of discussions that we will conduct over the next few months to discuss aspects related with our profession, either on the technology side, contact lenses, myopia, primary eye care, and any other special interest topics that the European Academy has been discussing in the annual meetings year after year. So this today is dedicated to one of the initiatives that the International Association for the Prevention of Blindness took very seriously and dedicates the theme of the year 2022, which is going to the public, communicate how they can treat their vision and their eyes better to keep a long-lasting eye health. So, as I mentioned, we have these international initiatives, but probably there are other local initiatives in your countries, in your regions that should be highlighted as well. So in the next few meetings, I will launch a survey I mentioned before. But before that, I would like to welcome your comments on some initiatives that you plan to get involved over the next few days. So we are approaching the World Sight Day tomorrow, and probably even this week or next week or tomorrow, you will be involved in some initiatives in your practice, in your community, going out for doing some screening in a school or in other institution, and share with us which are the activities you will plan to do, or if you are aware of some activity that is planned to be developed on your area of activity. Okay. So I believe that this year is going to be very quiet for the World Sight Day in several regions. And well, this is probably an opportunity to allow those a little bit more shy to participate through the answer of this small survey I will share with you right now. Okay, so I believe at this moment you are seeing, if you are seeing this European Academy Hour survey, that it's constituted by 7 questions that we would like for you to answer. Can you confirm if you are seeing this on your screen? Okay, so the first question is if at your national or regional level, the government institutions promote some visual health initiative or campaign with public impact. For example, it sometimes it's usual to see a national campaign where the national health systems are aware or make the population aware of the damage of diabetes or retinopathy, diabetic retinopathy, or myopia, or any other initiative. This might be done in newspapers, social media, or in a larger scale, well, larger from the general audience on TV, radio, and so on. You might not be aware at all of this kind of initiatives, or you are sure that your national or regional level does not promote any of this at all. So we'd like to know the reality in your areas. For this first question, does your national or regional government promote visual health with public campaigns? We have already some answers for some questions. The second question is related with if your professional association, instead or complementary to the government, does this kind of activities. Third question is related on you. How often you, us, are involved in public awareness campaigns to promote visual health. For example, I know that my professional association here in Portugal developed several initiatives in different media, particularly social media, but also on other TV, newspapers, promoting the dissemination of eye health. But we want to know what is the reality of your level. Question 4 is which kind of actions you, as a clinician, as an individual, as a professional, as an educator, promote yourself. It might be, as I mentioned before, visual screenings within the community, educational or literacy lectures on schools, elderly institutions, or any other kind of institution. Question 5 is if you are aware of these 3 specific days or events or activities: the World Sight Day, the World Glaucoma Week, the Myopia Awareness Week, or any other. And in this case, please use the chat line to make us aware of any other campaign or initiative you are aware of or you used to participate in. For example, some years there is an association that develops the Keratoconus Awareness Week, or the Keratoconus Day, or the Retinopathy Day, or the Maculopathy Day. So any other activity, please tell us if this is usual in your environment. And specifically for 2023. So even if you are not aware or you were not aware, now that you know when these activities will happen for 2023 or the expected date for those activities, were you aware of these activities for 2023 or any other? And in this case, and there are several people that is answering, yes, there are others. Please let us know in the chat line. We will collect this information and later on we will treat this information to disseminate also together to our members and even non-members to show that together we can discuss and we can enrich our knowledge about these campaigns, about these outreach activities. And of course, put probably some new activities in our scope for the coming years to be even more effective in being associated to these campaigns. And the last one is, which is for you the specific, or if there is a specific population or target population that for you is critical to be reached out with this kind of initiatives. You can give several answers. So this is a multi-choice question. All of them are multi-choice questions. So you can choose several in each one of these questions. So the total number of responses might be superior to the number of people presented here on the session, but this is because probably you can see yourself, or you can provide feedback in several options of each one of these questions. So I believe now we have, well, significant, no, I wouldn't say statistically significant, but a relevant example of what this small community thinks about these questions. And I will share with you now the results. I think everyone had the opportunity to answer, and probably this will allow us to start discussing about these topics and to allow you truly to be interactive in this session and show us your thoughts, your experiences, and enrich all of us with new perspectives on the dissemination of eye health to the public and make our eyes healthier and healthier. So I'm going to close the voting and share the results. At this moment, you should see the results, right? Are you seeing the results? So let's go to the first question, okay? So does your national regional government promotes visual health with public campaigns? In general,
we don't
sorry?
We don't see it.
You don't see it, okay? Maybe I can share my screen to show this to you, but it should be already there. Okay.
No, it is there. We can see it, but it is on a separate window. So you may probably want it on the back on the windows.
Okay. So some people is able to see it. I can see it on a separate window besides my Zoom session. So if you move your Zoom screen, it is possible that is hidden behind.
Okay, so we need to click on the survey, which is on bottom part of the screen. Yeah.
Okay, on the lower part of the screen,
yeah.
on surveys. And well, it depends on the language, but should be between participants and sharing or other reactions. It's about the middle. So if you cannot see it, I will report the results of the first question. So 73% of you consider that there are no campaigns promoted by national or regional governments. 27% responds that yes, they do it on general newspapers and social media, and 9% consider that yes, on TV and radio. So there is here a dominant answer, no. We believe that the government should be more involved in promoting eye health, or you believe that this should be done, as question number 2 will suggest, through professional associations. What is your perspective? Someone that wants to participate on this specific topic, the relevance and the role of governments at the regional or national level on promoting eye health? Or do we consider this is not their duty? Okay, maybe we don't have yet any thoughts on this, but when we ask about if your professional association does it, 73% say yes instead of no, and say yes on general newspapers and social media. So I see here, and probably this is your experience too, that at national or regional level, it is mostly the professional associations rather than the governments promoting these campaigns or outreach or communication initiatives. Does it agrees with your experience and your perspective?
Jose?
Yes,
I think if you split that into social media and general newspapers, you might find there's a lot more on social media than general newspapers because it doesn't cost anything.
Yeah.
I think there's a big barrier to being able to promote anything like this in the public domain because it costs money.
Yeah. Okay. Okay, so from this initial part, I will say that governments probably could do better and more about this. And probably there is room for improvement also from the professional associations side. But it seems that at this moment, they are doing better than the public institutions, the governments. So I truly think that this highlights the relevance of the professional association in promoting eye health, and within them, the individuals, so the clinicians, the professionals, the educators also in promoting eye health. Let's go to question number 3. How often have you been involved in public awareness campaigns to promote visual health? So 9% have never been, 55% have been 1 to 2 a year, 9% 2 to 3 a year, and 27%, this is remarkable, over 5 campaigns per year. So this demonstrates that in fact professionals, at least this small sampling here, it's frequently, I will say frequently involved in this kind of activities, and also some of them, I will say most of us are involved with some frequency along the year between 1 and more than 5 times in this kind of activities. This is interesting. So which actions do you promote? Well, of course, this is not an exhaustive list, and 64% are involved in visual screenings within the community. So I can imagine going to institutions, schools, and other places. During lectures, 64%. So these are the 2 dominating roles: visual screenings and educational lectures and discussion groups. Distribution of materials, flyers, posters, or any other information, 36%, and 18% indicate other activities. So I don't know if the chat has already some of these informations, not yet, so no one has included others, but please let us know which other activities do you do besides the visual screenings, the educational lectures, or the distribution of educational or information materials. This will be very welcome to understand which other aspects can be explored by us and by the people in this session. Question 5 was asking which ones of the following campaigns. Oh, thank you, Daniela. Opening eyes during the Special Olympics. That's interesting. That's interesting. It's a specific action, okay? And as I believe, there are several ways we can be involved in the Special Olympics. Some colleagues are evaluators to assess the vision of these persons, while others might be involved to make visual assessments, not as, I will say, specialists or specialists hired by the Special Olympics. How your participation can be done in this Special Olympics opportunity?
So if the Lions Club promotes the opening eyes, the regional optometrist or opticians can get involved, and then you basically go to the venue where the Special Olympics is held, and then the the people who are competing can then come to have a eye screening. And it's really nice to promote eye screening for special needs populations. We had opportunities to work with different institutions, higher education institutions, where the courses, the optometry courses, then as a whole came as part of a module, and also lots of regional optometrists have been involved. So it's a really nice opportunity for the competitors who are part of the Special Olympics, but also as an educational event for the students. I very much enjoy it always.
Mm-hmm. Okay, it's interesting. I understand that other optometrists act as, I will say, experts for the Olympics committee to certify that those people with special visual needs or special visual, say, deficiency, to make proof that it's objective and it's well, it is the condition they really claim is the condition they really have, because it depends on the categories they can compete and so and so. So there are these two roles. Very good. So question 5, which ones of the following campaigns did you were aware of? So for sure, 100% were aware of the World Sight Day. Hopefully, at least those involved in this session. It is the reason why we are here, one day ahead of the World Sight Day 2022. The World Glaucoma Day, 55%. Okay, the World Glaucoma Week, sorry. In some places you can find the Glaucoma Day, in others the Glaucoma Week. So depending on the international institution promoting or adhering to this glaucoma awareness opportunity, it might differ a little bit, but more than half of what we are, of those are here, are aware of the World Glaucoma Week. 45% were aware of the Myopia Awareness Week. Is something, well, quite new for the last 3 to 4 years, maybe. So it's not surprising for me that not all the people knows it. And there are others. So some people mention other opportunities. Of course, I mentioned, for example, the keratoconus one, but there might be many others for different eye conditions. I mentioned some of those that have an international reach, but maybe you have others on your radar. Could you please again write it on the chat so we can understand better which other campaigns you can adhere and you can bind with as eye care professionals? If you know the period of the year when they happen, the better. I will mention some of them in the 2023 year, but if you can send us the dates. For example, the World Sight Day is a fixed day. It's a Thursday on the second week of October. So this is somewhat like a uniform day. It might be the 12th, it might be the 14th, the 13th, but it's always on the same week, the same day of the week over the years. Well, hopefully only 45% were aware of the Myopia Awareness Week, but now 73% consider they will be involved on the next Myopia Awareness Week. So this is good because at least 3 people that were not aware of the Myopia Awareness Week pretend to participate. I don't know if they are the same person, but at least 3 persons will be involved in the Myopia Awareness Week that was not fully aware. Oh, Dementia Awareness Week, very good. Dementia Awareness Week from May 15 to May 21. That is interesting. That is interesting. So more. Thank you, Elaine, for this one. Okay, this is one I was not aware of that, and it's very important because more and more we know that dementia is also, or some forms of dementia might be associated with eye signs and symptoms, and sometimes they appear first even on the eye. But so far we cannot say that by a visual exploration we can, or the ophthalmologist or the neurologist or the optometrist might suspect of the presence of some forms of dementia. But we know that the vision, it is potentially affected by potentially affecting the vision. International Literacy Day you need good sight to enjoy this, of course. September 8th is a good opportunity indeed, Elaine, again. So thank you very much, because you are here associating, you need a good sight to enjoy literacy. So, and enjoy reading and enjoy keeping your eye health to read well. United Nations Global Road Safety. Thank you, Eva. Road Safety Week, 12th to 16th of May. Very interesting. And we have here the dates for 2023. So I believe that we are starting to build up a portfolio of actions that, depending on the profile of the population where we are based or our practice is based, might be adapted. So probably for your I would say, patients, some of these campaigns make more sense than others, but here are well, a handful of opportunities to participate and to get more involved on visual awareness and on visual health awareness for the population. Very good. So we have the last question that was related with the specific profile of the population that you will seek to focus your attention. The young adult, I will say this is somewhat surprising for me at this moment. Probably the pediatric population, it's a common point. Also the elderly population. So now we are very aware of the relevance of these two extremes of the age scope of our practice. On one side, myopia and metropization, and on the other, the prevention or early detection of visual problems. But the majority of you has answered 10 in 11, 91% to young adult population. So I would like to hear more on the reasons why you believe that the young adult population, it's one of the main targets for your actions. So it is an interesting answer for me. So 73% pediatric population, 64% elderly population, and 91% young adult population. Could someone develop a little bit more on this? Please don't talk everyone at the same time.
So, Jose, if I can start,
yes,
with some thoughts here. I ticked all the boxes here. I think with the young population, the reason that we want to have a focus on that specific group is due to the myopia, I believe, which is, we know that the myopia is growing with the age, and the young population is really at risk of high myopia in terms of prevalence, of magnitude. And then it's very important from the work perspective. I mean, productivity and everything, and also I would say the near work is very very demanding on that population, working on computers and screens, everything we know. So that may be the reason. I don't know what other things.
It's a good point, Eva. Ellen, please go ahead. You have raised your hand.
I have, sorry about this. I'm actually standing some walls while I'm listening, but I felt like I wanted to say something. I didn't actually answer the poll, but I think the young population is very interesting, and I agree with the points made by Eva. Was it? Yeah. But in Northern Europe, and especially in Scandinavia, we have very many hyperopic children, and we're quite concerned with their vision because they're very often overlooked, and we know that having good vision is so important for learning. So if you have a hyperopia, and we're all optometrists, we know what that means. It means that maybe they will be more tired, they will not sustain their work as long, maybe they will start avoiding reading, or doing near work. And certainly in Norway, there's unfortunately quite a lot of children who are suspected dyslexic who will not get a proper eye exam, even though that is actually mentioned in what the special pedagogic people are supposed to do. So I'm really concerned about kids because they're just at the start of learning. So yeah, I could talk for hours probably about this. So one of my babies. So yeah, so this is my point. Okay.
So Maurice has done some interesting inputs here as well. Maurice, do you want to participate with some additional thoughts? Thank you for commenting on the chat. Okay, so good point. So I believe that the bottom line of this is that we have to consider the awareness on visual health on the whole scope of the population. And Maurice made a very interesting point that if you want to reach the kids, you have to reach also their parents. So they are never alone in our examination rooms. Of course, the aspects related with working, productivity, of course, our young population and adult population is the key. And probably this is an excellent point. So at this moment, when many people consider as something normal to approach specifically the younger population for the myopia onset, myopia progression, interventions on myopia management, and the elderly population where many diseases could happen, and particularly, of course, presbyopia and so on. Don't miss those in the middle, because they are truly a focus for us too. And for professional deformation, I will say, I believe that, of course, this medium, early adult, so young adults and adults are where our contact lens fittings are made most frequently. So they should be a frequent target to make them aware of the dangers of a misuse of a contact lens, and also communicating to them the opportunities they have to use a different mode of correction from they might be habitual. We can also add another drivers. Okay, drivers specifically, Eva. So you have raised the driving before, and now you are reinforcing the opportunity with drivers. Okay?
Yes, I believe, just one word on it. I believe that there is a lot of work to do, and I hope that you are aware about the efforts made by ECO as well in Europe on driving license. We still have countries where we can be blind and still have driving license, or almost. So I think this target is very important. And I agree, as I said, with Daniela on refugees and displaced people, all lacking access to eye health services today in Europe. We have many of them.
Yeah, I have to highlight on this domain that the Portuguese Association of Optometrists, APLO, this year is developing a specific action for this World Sight Day on homeless people to evaluate their vision, and going there with a task force of eye care practitioners coordinated by APLO to evaluate the vision of homeless people, because, well, we shouldn't say that is all, but probably this is also an additional opportunity for these people to be in a better shape, to get more active, and to get back to the society with their full potential, because they have it. And sometimes the life took them to a place where they cannot explore that potential. And vision continues to be a central part of our health as well. So this is well in line with several countries and associations are doing even for this year. Interesting aspect. Well, I will say, just to mention that last week we had 10 days ago, the European Night of Researchers. So for the institutions, for the academic institutions, the European Night of Researchers is also a good opportunity, because thousands of students with their families go from their schools and from their homes to this places to know more about the research that is being done. And of course, those universities or institutions that have courses of optometry used to go there with their researchers on visual science, ophthalmology, optometry, optics, to share what they are doing in research. And this is also an excellent opportunity to have the younger, the older, and those in the middle to disseminate this. Eva, do you want to participate again?
Yes, sorry, I wanted just to build on your point because I think at the beginning I didn't react to you. I didn't react to your first question, what we are doing at national level.
Okay.
Because the question was on the national level, but there are some great things to share, I think, on what's going on right now on global level as well. And I wanted just to tell you that yesterday and today we have very great happenings in New York, actually at United Nations headquarter offices. There is a collaboration between IAPB, so International Agency for the Prevention of Blindness, Vision Spring, and also the One Sight Estereoptica Foundation, talking about the importance of vision health, but also doing something I think even more impactful and engaging. They do screenings for all ambassadors working in the offices. So I believe there is another, I think, great initiative to involve people at the highest level and bring the World Sight Day opportunity as a great moment to talk about eye health, the importance of eye health. So Love Your Eyes that we see on your background, José, is today also flagged in New York, thanks to our friends doing the screening. So I wanted just to share this with you.
Okay, great. Well, it is brilliant that these opportunities have this impact. So besides these small discussion groups, and I feel that I feel more rich. I feel richer now on my opportunities to implement over the next year several actions, and some very nice ideas come out from this session. Elaine, please.
I just wanted to go back to sort of younger people, sort of young adults. My daughter's teaching at the moment, and it's amazing how many of her students who are about 18, 19 years of age, 17, 18, 19, have headaches and depression and are underachieving. And I don't know whether that has a link or not to the fact they might need a good eye examination. But I do know an awful lot of people do not have the culture of having regular eye examinations because parents don't automatically take them when they're children, so they don't have that culture to go when they're young adults unless they have a problem. And I don't think they necessarily think that they might have a sight problem. But I do know there is a culture of, certainly in the college where she is, of underachieving, of depression and headaches. I just thought I'd throw it out there and see if anyone wanted to catch it, because there is a mental health awareness week as well, that maybe we could link vision to.
Okay, yeah. Well, you pointed to a very relevant aspect. So some people, I say here, arrive to our practices at 18 years of age for the first time, but other people even later and later. So when they start stopping seeing at close, on the 40s, for example, this is incredible how on our current society, people is not aware that eye health is not that we should take as given, but we have to take care of. And we were not able yet to give this idea to the population. And this is also our responsibility. People consider that health is something that is taken as given, but there is much more we can do with eye health to preserve it, to take care, to use our eyes properly, to use additional devices in a way that could protect us and our vision for the future. So probably we have to change that mind also in the society, and not only go in and say, well, take care about myopia, take care about presbyopia, take care about contact lenses if you use those, even if you have what you consider is a perfect vision or you have a good vision. Don't stop evaluating frequently your vision, because your vision can change, because your vision might be under stress even before you notice that. So that is a relevant point.
I also think that the cost of living crisis and poverty is going to have a big impact as well. You know, that there are students coming through who don't have a hot meal every day, that kind of thing. So there will be problems. People are going to have to make choices, and eye health might not be at the top of their list.
Okay, very good point. Very good point. So, of course, we will always, unfortunately, we will always have limitations for eye health and health in general to be equally distributed. That is a big problem. But we can do more and better than we are doing as a community. And of course, also our governments, our institutions, our associations. But everything starts by the individual. So we as individuals can do better. We can sensitize even better our associations, our governments, putting pressure on our institutions, and raising the literacy, the awareness on eye health a little bit higher globally, but starting, of course, on our backyard. That's it. That's a possibility, even within the limitations we have. Okay, so someone else that might share some thought on these topics we are discussing, or any other one connected with the awareness on visual health that might be relevant, how new technologies might help us with that. So the databases you have in your practices, but they are biased because they are biased to those that already need your practice, your services. So the thing is how to reach those that are out of the system. Daniela, are you raising your hand? Oh, good.
I just wanted to make a complete different point. So sorry, Jose. I think one point we really need to consider when it comes to eye health is interdisciplinary working. So not only awareness for populations within the general community, but also between healthcare practitioners and other professions, because very, very often when they come to us, there is already a problem which has been seen long, long ago from other healthcare providers, from education people, from social care sometimes. And I think what is really missing in terms of eye care is that we work with different professions together and give them something at hand to work towards to us. And I would like to see if we have something like a Allied Health Profession Day, where we all share knowledge and how we can actually make things work together as a health community. Now I think of falling in elderly, when it comes to falls, when it comes to younger children reading, or as we earlier said, with generally hidden or minority populations. We very seldom have access to them, but a lot of other professions do have access.
Mm-hmm. Okay. Interesting point.
Sorry, I completely was out of what you just started to say. Sorry.
No problem. No problem. I'm just waiting for more participations. So welcome, Rupal. We were discussing the results of our query. I think you can see it. You can see it there. So it is a small pilot survey, I will say, but we could scale up this through other possibilities. And among all, we have more initiatives here on the chat that will be relevant to share with our members, with our non-members, and as a community to raise this level of awareness. Now I will leave the wheel on the hands of Daniela for these last 9 minutes. And well, we'll get back later on. We'll keep on the session, but now I will silence my mic. So any other thoughts, please go ahead and use these last 10 minutes we have for the discussion.
Thank you, Jose. Yeah, it would be really interesting to hear about your good practice and what you're doing within your community, and to raise awareness, or to where you find there are barriers to raise awareness. I think when we start there, then we can find out what we can do. Rupert.
I've just come back from a conference, and one of the things they were talking about is when we talk to patients about patient education, us telling them doesn't mean they have understood. And maybe we need to think of different ways. And Elaine very kindly has put the video up that, you know, we need to think of different ways in which we send the message out to patients. And there's research papers out there that say that when you tell them in an eye appointment or in a consultation information, only 50% of the information is retained, the rest isn't. So should we follow up with email reminders, videos, or links for them to know about their condition, or prevention messaging? And Jose has put down, you know, how do we involve those who don't consider they need help, the inequality stuff? And I'm trying, and you're talking about good practice, I'm trying to set up a homeless vision testing. So people are homeless who don't feel they can go into a practice because they feel overwhelmed. They don't look after themselves because maybe their eyesight isn't good. It's one of the things I found out is you need to take the service to them. They're not going to come to you. You need to go and find them. You need to take the service that works to them for them to engage. And once you get them engaging, they will then stay and it can make a difference. So that's one of the things is every community, regardless of where we are based in the world, we need to figure out how we open those doors to people who are not thinking about eyes. And as Elaine quite kindly raised, eye health is now dropping down when people are going hungry, or people are cold, or don't have a roof over their head, or can't afford to pay rent. It drops. It doesn't become a priority. But we need to keep putting our message out to say it can make a difference to the quality of life that person has. It doesn't have to cost too much.
Eva.
If I can, I'd like to build on your point, Rupal. I think as ACAR community, it is difficult to do everything by ourselves, and I think that collaborations and partnerships with associations working with homeless people can be helpful, and we need to think that way. I will give you just one specific example. I'm based in France, and in France we have associations working with homeless people, refugees, and others, helping them to find food, helping them to find some clothes, and so on. And there is a collaboration between those associations, making a fantastic job for years, and the Rothschild Foundation, for instance. The ones who are in direct contact with homeless people organize and suggest eye care services or eye check, eye exam, and then others take over from them and do this examination. So it is just one example, and our foundation is also involved in that. It always can happen when we have great collaboration and partnership. So that would be my thoughts.
Thank you, Eva. Liliana. Liliana?
I'm sorry. We all of us, we are aware that optometry and optics doesn't develop the same speed across Europe. And here I see the important role of our academy. One of our vision is to raise the standard and to harmonize the praxis across Europe. And this is why probably in countries like mine, for example, we don't have any governmental program or any associations activity, professional association activity. That's why probably we need to work in this case together with another institutions. Our strategy as academy is to develop and maintain and also to upgrade our partnerships with other educational institutions. And I hope this will help the optometrists and opticians in countries like mine to become more aware in their competencies and skills to participate in such events like World Sight Day. That this is really very important to realize it, because I tried many years ago to do by my company some activities, but I didn't get any support, whether from the professional association or from the government. So one person cannot change this. All of us together, we should work and to raise the awareness about eye health and about the role of optometrists and opticians in Europe.
I very much agree with you, Liliana, and everything which was said before, because I think—
Sorry, I hear you very, very difficult, but I'll try to do my best.
I think as an academy, we have a really good opportunity to also give practitioners strategies at hand to deal with the lack of awareness, but also to provide reasonably good and accessible support for difficult situations. Because very often, what I see in practice is that people want to do something, they just don't really know how to. And that's where we can come in as an academy, that we provide communication strategies, reach out strategies, that we help people overcoming those barriers. Because we know quite a lot of where those people are who are not aware of eye health and eye care. But we yet have, in all the countries really, yet failed to provide and educate the practitioners enough that they actually can deal with that properly. And that's where I see a big chance in the future to really make a good impact. I don't know how you feel about that.
Sorry, and as I heard probably properly, because I said the connection is bad, but partnerships with other organizations working in the field of research and education, or partnership with industry, it's also very a key moment for us as a practitioner to participate such events and to raise the awareness in our professions.
Yeah, absolutely. Eva, Rupert, do you want to add something? Elaine?
I think Liliana said it, partnership, collaboration.
Okay, I think...
Sorry, Daniela, I just think it's, I think the EQ meetings are important, because we do get to learn from each other, and we have the interaction one-to-one. I was just thinking then about the presentation that was made by Zsolt in Hungary last year about his association went screening in orphanages and supplying glasses in orphanages, but that led to a better conversation with the government in the end, and that allowed them to do other projects, and it pushed them up on the list of the people that the government wanted to speak to. And if anyone can go back into sort of the EQ files, if you have a look at Zsolt's presentation, it was quite interesting. So you know, they're things that come left field that you don't expect to hear, but you know, when we get together, it's nice to be able to look at other people's initiatives a little bit closer.
Absolutely. I don't know, Jose, if you want to join us for the final words? Raoul.
Hi everyone. I don't. Well, I got just a moment.
Sorry, we couldn't really hear you.
Sorry to interrupt because I'm in the middle of attending some patients, and but I was trying to get you know, at least to maintain the thread between your conversations, and there's something that I think that would be important to say because it occurs today. Recently, the European Commission has presented a proposal for statistics related to the different activities and economic activities and professional activities. And there's a lot of health professions who has its own categories: human dentistry, physiotherapists, and you have to excuse me just a second, please.
No worries.
And so, and we because I'm a president of the Portuguese Optometric Association, we requested that optometric services have its own category, so it can be explicit mentioned in all the European statistics, the existence of these professions. And, you know, optometrist doesn't seem to exist in any kind of health workforce category. And we should be thinking why this is like it is. So we made our input, you know, in here, have you what to say within the European Commission. We asked ECO to also come up with its own input, and we requested that optometric services have its own category. We made a proposition with specifics, the number it should have, and ECO, for example, made its propositions, but it included optical services. Can you guess the response that we got from the European Commission? It is surprising, but, you know, for anyone that doesn't, you know, has been accompanying the field for quite some time, but it wasn't surprise for me. They said that optometric services are part of optical products, sales, retail, and as wholesale. And it should be included in commerce, not in healthcare workforce. It's like a, you know, a punch in our stomach, because they recognize that optometrists provide health services, but their main core of activity, what they name the greatest value added, is having sales of, you know, products, which, by the way, in the European Union are called medical devices. So we should have a strategy to deal with this, and we should be aware that whenever we bring opticians, optical to the same pot, we probably won't be able to develop the two O's, the optometric and optician, in the way that we probably intended to. And this reflects the perception that society has, at least in Portugal, it is so, of the optometrist and the eye health and the eye care. It doesn't take, you know, it doesn't occupy a high priority. It is regarded as being part of the health, is not being something that it is really important. It's something commerce and spectacles bought anywhere, you know, on the shop on the airport are sufficient to deal with this, you know, with reflective error. And we should be all asking ourselves if we are sending the wrong message, if we are framing our goals, our strategies in the correct way, if we are, you know, seeing this from the public point of view. So sorry for taking me so long to try to get my point of view across. You can, you know, if you search on the European Commission public consultations, you'll find it in the European statistics proposal from the European Commission. And you know, it's another lost battle. But just to finish, recently WHO issued a report about the health workforce, and again, optometrists are not a part of this report, which is shocking. But when I ask the authors why this is so, they reply, perhaps next time we can take a look at it. And so, you know, it's heartbreaking, but it reflects a lot of how society views optometry, at least in some countries. So thank you for your time, and, you know, sorry for all the interruptions, and, you know, just leave the floor to you.
Thank you for your comment. I think it shows very, very much the need that we become more involved in policy making, and that we as a profession stand up and getting involved with the European Commission, the European Union, and policy making authorities in all the countries. Other health professions have done that, and I believe very strongly that we can do that too. But as you said, we need a strategy, a coherent strategy across the countries, what is achievable and when something is achievable and which resources we have available for that. I don't agree that it is a lost battle, to be fair, but that might just be my passion and naivety, I'm not really sure. Bhupal.
I was going to say, Raoul, good points. And I think ECU is the right forum to try and get the policy change for the European Commission. But what the Academy can do is we can continue providing professional development opportunities so that individuals, local national associations can go to their ministers and go to their governments and saying, we are professionals, we are health professionals, and here is our international or European-wide professional development engagement. So we carry on as individuals, clinicians, and healthcare workers developing ourselves. So if we use a two-step approach, one through ECU and policy, so that's going to the European Commission, but then in individual associations like you have done, but then raise the bar, tell the government that we are healthcare and we will continue to do professional development, where this is where the Academy can come in, support, provide certificates, provide different platforms, engagement, international speakers coming to talk to everyone. I think that helps to showcase what ophthalmic practitioners, let's use ophthalmic rather than optical, because then optical can be more commercial, but ophthalmic eye care professionals are doing.
I think on top of, you know, the professional development, the initiatives like awareness raising is also another way making us visible in the space of eye health, in the space of health. So the conversation that we have today is very, I think, beneficial and provide thoughts for that, because we can be proactive also in a different way. There was a very interesting point made by José saying that prevention should be also a part of our conversation. It's not only about selling, it's not about only treatment of eye defects or eye conditions. It's also how we care about our patients and future patients and be visible. And I think World Sight Day is a great opportunity for us to think what we can do more or better or differently next year to make optometry on the top.
Well, this is the start, as Jose said. These are our starts. So let's see if we can carry on building.
I think we very much can. Thank you. Thank you everyone for joining. We're already overrun by 12 minutes. Oh, here's Jose. Or his arm. Okay. Thank you very much for joining. And I hope you have a lovely evening and hope to see you on one of the other events. Thank you.
Happy World Sight Day. Thank you.